here, and pediatric and neonatology department we have full-fledged pediatric neonatology department and an ICU care, PICU care, and the spine surgery, psychiatry department is here, and even interventional radiology department like doing the procedure in the interventional radiology departments, and we have critical care units with four CCU and all, then full-fledged cardiology department and nephrology departments, RGR surgery departments. The diagnostic facility, like we have well equipped radiology and imaging point and doing all the CT scan procedures and MRI, then digital X-ray unit we have, or image intensifier with image intensifier, and for mammography departments, yeah, we are doing the mammographies for detection of cancer, breast cancer, and advanced case of the art laboratory and equipments we have, all routine and advanced pathology, biochemistry we have, and we have microbiology. And infrastructure at its best. We offer our patient 150 bedded super specialty hospital through dedicated departments like 60 departments we have. We offer cardiology, again, all the type of departments we are offering. uh, Unlike other departments like the physiotherapy and on surgery, Ayurveda, spine surgery, radiology, hepatology, voice clinic, then research center, we have research center, then ENT, biochemistry, or for the patients, dietitians and dietetics, every advice is going so take section medicines, and again sports medicine we have intern mental radiology and electronephrology, critical care, and full-fledged cath lab we have, and doing the CAG procedures and angioplasty doing here in the cath lab. Other services, round the clock radiology and pathology departments we have, around the clock food and drug admin, and in-house we have in-house mortuary, then recognized MTP and FE center, and the Javik registered newspapers we have 4 weeks, and other physiotherapy rehabilitation center. Central India's allied institutes and other allied institute and organizations, Central India Health Academy and Oral City Bahu Uddeshya Sanstha we have, Dignity of the Dead Foundations, Nagpur Institute of Medical Sciences, National Human Care Foundations, and we have non-scope service, like non-scope service included in the one is CABG, chemotherapy, radiotherapy, and genetics and molecular biology, not included in this proper service. Next up, I'll talk on the topic how to handle patients and relatives. Our Orange City Hospital's vision is to create a positive impact within available resources in the interest of patient care and provide quality, comprehensive, and preventive medical services. We want to bring strong patient focus and bringing about the social awarenesses to the needies. So, first of all, we have to listen with concern and empathy, and we have to bring the patient's frame and motivate the patients, and any problem related services. First of all, we have to do one thing: isolate the relative if possible, so that others may not listen to their conversation or overhear. So stay calm and don't argue with the relatives or patients at any time. Don't argue anything. Stay calm and listen the problems with the relatives or patient. Be aware of the relative patient's self-esteem. Show a personal interest in the problems. Or try to use the name of the patients or relative frequently. Just they can understand we are listening to their problems. So listen very carefully and keep eye contacts with that particular patients or relatives. Give the patients or relatives your undivided attentions and concentrate on the problem and not on placing blame on each other. Do not insult the person or customers. And take notes if you want. Write down key facts. Save time if someone else gets involved. Also, the relative tends to slow down when they see the front desk employee try to write down the issues. So, take notes, note down the issues they are facing in the premises, or tell them what can be best done. Don't promise the impossible and do not exceed your limits, abilities. Set an appropriate time for completion of corrective action in case of any problems. Otherwise, we can verbal answer and we can solve it verbally. Monitor the programs. If any problems occurs, we have to take correct action. So monitor the progress of the corrective action. Then take follow. Even if the complaints was resolved by someone else, contact the relative or patient to ensure that the problem was resolved satisfactorily. For regarding the visitors policy at our Honor City Hospital, there are some timings for visiting the patients admitted out to our various departments. For regarding the CCU, the timing was kept 12 noon to 1 p.m. For 1 hour for the critical care patients, the relative can go and see the patients 12 noon to 1 p.m. And again, the evening schedule 5 p.m. to 6 p.m. For wards, we are keeping 2 hours for the relatives to attend the patients. Every day, 5 p.m. to 7 p.m., we are allowing the relative to meet our patients. Relative must maintain, and the rules are there. Relative must maintain silence and must not disturb other patients and their privacy. And do convey, every time do convey that at the time of admission, convey that the relative, we are not responsible for your valuables and belongings. They have to take care of their belongings and valuables and not entertain, because sometimes it is very very मैं जल्दी जल्दी पढ़ के गया तो खत्म हो गया लेबर करना है तो ना वही मैं लिख लिया था जब करना पड़ेगा जल्दी फास्ट